Hypertension is often described as high blood pressure, but in reality it is a complex disorder of vascular control involving the heart, kidneys, blood vessels, hormones and nervous system. Every second, these systems work together to maintain adequate circulation. The heart determines how much blood is pumped. Blood vessels determine how much resistance that blood encounters. The kidneys regulate blood volume, and the autonomic nervous system constantly adjusts all three. In many people with hypertension, the sympathetic nervous system becomes overactive. The body behaves as though it is under chronic stress, releasing signals that increase heart rate, strengthen cardiac contraction, and constrict blood vessels. This raises blood pressure and places a greater workload on the heart. At the same time, the kidneys may retain excessive sodium and water, expanding blood volume. The renin-angiotensin-aldosterone system further amplifies the problem. Renin triggers the formation of angiotensin II, which constricts arteries throughout the body. Angiotensin II also stimulates aldosterone, causing additional sodium retention and vascular remodeling. The blood vessels themselves change as well. Healthy arteries produce nitric oxide, a molecule that promotes relaxation of vascular smooth muscle. In hypertension, endothelial dysfunction reduces nitric oxide availability, while inflammation and oxidative stress increase vascular stiffness. The arteries gradually become less compliant, creating even greater resistance to blood flow. Over years, these mechanisms reinforce one another. The heart develops left ventricular hypertrophy as it pumps against higher pressures. The kidneys suffer damage from increased intraglomerular pressure. Small vessels in the brain become vulnerable to stroke, while coronary arteries face accelerated atherosclerosis. Modern antihypertensive therapies target these different pathways. ACE inhibitors and angiotensin receptor blockers reduce angiotensin signaling. Mineralocorticoid receptor antagonists block aldosterone. Diuretics reduce excess fluid volume. Calcium channel blockers relax vascular smooth muscle. Beta blockers blunt sympathetic stimulation by reducing heart rate, cardiac output, and renin release from the kidneys. Additional agents such as alpha blockers, central alpha-2 agonists, direct vasodilators, and neprilysin-based strategies may be used in selected patients. Viewed through a systems lens, hypertension is not simply elevated pressure in a pipe. It is a chronic dysregulation of the biological networks that control vascular tone, blood volume, and cardiac performance. Successful treatment comes from understanding and correcting the specific mechanisms driving that pressure upward.